Welcome to The Explainer. Today we're jumping right into the German health system. It's one of the oldest and, frankly, most influential systems on the planet, and we're going to be using a landmark report from the European Observatory to really unpack it all. The good, the bad, and the big digital changes that are happening right now.
Right off the bat, the German system is this huge paradox. On the one hand, you've got universal coverage, amazing access to care, and you can pick your own doctor, which is great. But then on the other hand, it is the most expensive system in the entire EU. And here's the kicker. For all that cash they're spending, the results are, well, they're just kind of average. So you have to wonder, where is all that money actually going?
And that really is the million-dollar question, isn't it? How does a system that's so old, so complex, how does it even begin to balance those deep historical roots with all the pressures of modern healthcare? So let's get into it. Let's really see what makes this thing tick.
Okay, so to really get our heads around this modern puzzle, we have to rewind. Way back. The whole system is built on a foundation from the 19th century, and that original DNA, it's still shaping pretty much every single decision being made today. All right, so the story kicks off back in 1883. You've got Chancellor Otto von Bismarck, and he introduces the world's first ever national social health insurance system. Think about that. That same basic system was then stretched to cover a reunified Germany in 1990. And what's just wild is that now, over 140 years later, its core ideas are still going strong.
And the one big idea holding this whole thing together, it's solidarity. Now that's not just some nice-sounding word. It is the absolute heart of the system. It means what you pay in is based on how much you earn, not how sick you are. And what you get out of it, the care you receive, is based on what you need, not what you can afford. It's a really powerful social agreement when you think about it.
So all this history has created this kind of dual system. But really, the numbers tell you everything you need to know. The huge majority of Germans, we're talking almost 90% of the population, are in the mandatory public system. It's called statutory health insurance, or SHI for short. Only a pretty small group of higher earners actually has the option to go for private insurance instead.
But here's the thing, that super strong foundation from Bismarck's time, it's also created some serious modern-day headaches. What started as a clear design has, over time, turned into a 21st century labyrinth. A real maze of different rules, different sectors, and different providers that don't always talk to each other. And this is a perfect way to picture one of the biggest issues. You have this really sharp divide between outpatient care, your family doctor, a specialist you see in their office, and inpatient care, which is when you're in the hospital for a procedure or an overnight stay. They are like two separate worlds. They have their own budgets, their own rules, and trying to get them to work together for a patient can be, well, a real nightmare.
And surprise, surprise, a complicated structure like this costs a ton of money to run. Just look at this number. Back in 2018, the amount Germany spent on healthcare for every single person was the highest. Not just high, the absolute highest in the entire European Union. That's a huge, huge investment.
So where does all that money go? Well, it fuels a massive amount of services. You can see it right here. Germans use both hospital care and doctor visits way more often than people in neighboring countries. And that brings up a really important question about efficiency, right? Is more care always the same thing as better care?
And the report we're using as our guide for this, it doesn't pull any punches. It says this separation, this fragmentation, it's not just a little inconvenient. It is a fundamental barrier to getting patients coordinated, continuous treatment. And that, right there, is the central problem the system is wrestling with.
But Germany isn't just sitting around letting this happen. Nope. There's a massive push to modernize, and a huge part of that is turning to technology to try and fix some of these old, historical problems. So let's take a look at how they're trying to build a more connected future.
And the pace of change here is, honestly, it's pretty staggering. Now, we're not talking about one big revolutionary overhaul. It's more like a constant stream of small changes. But get this. In 2019, a new health law was passed almost every single month. That tells you just how focused they are on reforming things, especially when it comes to going digital.
So what's at the center of this whole digital push? It's the electronic health card. Now, it was delayed for years, but the rollout is finally picking up steam. And the idea behind it is huge. We're talking about one single card that's meant to hold your emergency data, connect to your electronic patient file, handle e-prescriptions, basically to finally get information flowing smoothly between all those different doctors and hospitals.
And it's not all just about gadgets and software. Germany is also trying out some really innovative new ways to actually deliver care. Things like special disease management programs for people with chronic illnesses to make sure their treatment is better coordinated.
And they're also setting up integrated care networks that is specifically designed to, break down those walls between the hospitals and the doctors in their offices.
All right, so we've looked at the history, the challenges, and the new reforms. So what's the bottom line? Where does this all land? Let's try and give the German healthcare system a final report card.
Okay, if we were actually grading it, it would be a real mixed bag. For things like access to care for everyone and making sure people don't go broke if they get sick, it gets an A+, no question. But when you look at how efficient it is and what kind of health outcomes they're getting for that super high price tag, the grade drops to more of a B-. There is definitely room for improvement there in terms of getting more bang for their buck.
And all of this leaves us with one huge final question. Germany is essentially layering these 21st century digital fixes on top of a 19th century foundation. Is that actually going to be enough?